Hello, my name is Daniel Patterson. I'm a researcher at the University of Pittsburgh Department of Emergency Medicine, a practicing paramedic, and the principal investigator of the 2018 Evidence-Based Guidelines for Fatigue Mitigation in Emergency Medical Services. The guidelines are a wonderful resource for EMS clinicians and administrators. The purpose of this video is to highlight a select number of strategies that may be of some help to EMS clinicians as they work during the COVID-19 pandemic. In this brief video, I will review a few select strategies that may be useful for individual EMS clinicians who must work extended shifts, extra shifts, or overtime during this unprecedented time. I will briefly review adequate sleep, banking sleep between shifts, napping, strategic use of caffeine, and assessing sleep health. On average, most U.S. adults report getting 7 hours of sleep per night. 1/3, however, do report inadequate sleep, and many report some problems with sleep. Our research shows that half of EMS personnel report less than 6 hours of sleep per night, meaning that many do not obtain the sleep they need. During the COVID-19 pandemic, it is very likely that many more EMS personnel will not get adequate sleep. One strategy to consider is banking sleep. Banking sleep refers to the amount of sleep that one can obtain before a set of scheduled shifts or in between scheduled shifts. Our team recently published a systematic review of the evidence and determined that banking sleep can help reduce feelings of sleepiness, improve alertness, reduce feelings of fatigue, and have a positive impact on sleep latency. When feasible, try banking your sleep by extending your main sleep period by 1 to 3 hours. Please know that recovery sleep is different. It may take several nights of recovery sleep before a sleep cycle can return to normal. Previous research shows that 1 night of 10 hours of sleep may not be enough to recover from a work week where sleep was limited to about 4 hours between shifts. Napping during shift work may be controversial in some settings, and thus may not be allowed. If napping during shifts is allowed, try to use napping as a strategy to mitigate fatigue. A recent review of the evidence shows that napping during shifts, specifically during night shifts, can help to reduce feelings of sleepiness that one often feels during night shifts. The optimal duration of a nap taken during an EMS shift is not yet known. While the evidence is in support of napping during shifts and a key component of the 2018 Evidence-Based Guidelines for Fatigue Risk Management in EMS, many are still concerned that longer duration naps may increase the odds of sleep inertia. It's that groggy feeling we experience when waking. Some research shows that sleep inertia may be less of an issue if the nap is of a very short duration, such as a 30-minute or less nap. If you are allowed to nap during a shift, consider using short duration naps as a strategy to help stave off feelings of fatigue and sleepiness. Many first responders and many in EMS are familiar with coffee and other sources of caffeine. A recent systematic review of the evidence determined that caffeine can improve vigilance for shift workers when working shifts. It can reduce the number of lapses in attention and have a positive impact on reaction time for those who work in shifts. There is no prescribed optimal dose of caffeine for EMS clinicians and other first responders. However, some previous research suggests that when faced with a prolonged period of limited or deprived sleep, low doses of caffeine, when consumed hourly, may have a positive impact on fatigue. Many in EMS who are working during the COVID-19 pandemic will experience periods of limited or no sleep. Strategic use of caffeine could be one strategy for fatigue mitigation. Many first responders and EMS clinicians do not regularly assess their sleep health. It may be a real challenge to try to fit this in. If feasible, we recommend that EMS clinicians periodically, maybe once every week or 2 weeks, assess their sleep health and make adjustments to factors that are modifiable, such as timing of sleep. As a frame of reference, good sleep health refers to subjective satisfaction, appropriate timing, adequate duration, high efficiency, and sustained alertness during waking hours. A very easy and quick way to assess your sleep health is to use the RU-Sated tool developed by Dr. Dan Bicey of the University of Pittsburgh. The tool is comprised of 6 questions and 3 response options for each question. The scoring is easy and ranges from 0 to 12 as a total score. Scores that are closer to 0 would suggest a poorer health sleep quality or sleep health status, whereas scores closer to 12 would indicate a more positive or good sleep health status. EMS clinicians and other first responders may consider using this easy and quick tool to help monitor their sleep health and to evaluate if actions taken to mitigate poor sleep or fatigue are helpful over time. The COVID-19 pandemic is unprecedented, and many of our nation's first responders and EMS clinicians are facing challenges, including loss of sleep. They are working extra shifts or extended shifts. While all are proud to serve and are up for the challenge, we should do everything we can to protect health and safety. One key component of health and safety is sleep. Try to adopt some of the strategies outlined in this video to help improve sleep and sleep quality. Thank you for your service, and please stay safe.